What to look for is certainly key to saving someone's life and for reducing the long-term effects of a stroke. May is Stroke Awareness Month. It's really an important time to discuss the signs and symptoms so you can learn how to catch a stroke early. It's so important. Tonight, Hartford Healthcare and the Hartford Yard Goats are partnering to put a spotlight on the strikeout stroke community. And here to tell us more about that is Dr. Omri New. He is the director of the Comprehensive Stroke Center at Hartford Hospital. Welcome, doctor.
Thank you for having me.
You know, let's talk a little bit about the importance about awareness, because time is brain in the stroke world, right?
100%. I think that understanding stroke signs and symptoms for the community and for everybody who has family members or friends to be able to identify a stroke in the field or figure out if that's going on is key, and calling 911 immediately if that happens. Yeah.
So that's when people sometimes don't do that. They don't call 911 because they're unsure. So what are the signs that a person is having a stroke and really should do something?
Sure. We'll use this word called be fast, and each letter stands for something. So B would be a sudden attack or episode of loss of balance completely, falling to one side, for example, unable to walk. The E would be for eyes, loss of vision in one eye completely, or both eyes, or one side of the visual world. And then the F would be for face, so sudden facial drooping and drooling of the mouth. The A would be for arms, arm weakness, so if one of the arms drifts down and becomes weak. S for speech, that could be slurring of speech, that could also be difficulty finding words, some language difficulties. And the T is time, which is what we talked about. So be fast, identify stroke signs and symptoms, and then be fast by calling 911.
And what are some of the recent advancements for stroke treatment?
Yeah, that's a great question. So currently, if someone is experiencing a stroke and they come in on time in the hospital, the therapeutic window or the time we have to do something about it emergently has been expanded for a large subset of patients. Clot-busting medications that can be given through the IV are considered the standard of care. And then state-of-the-art thrombectomy procedures, where if there is a blockage up in the brain, that could be done through a procedure going through with a catheter up to the brain and pulling out that clot. And that could be up to 24 hours for some select folks. So there are definitely treatments that are out there that are proven that can help reduce disability, and folks should know about that.
All right, doctor, thank you. I want to invite everyone to visit the Stroke Out community tonight at the Hartford Yard Goats. You'll be raising awareness and teaching folks all about it. And for more information, you can visit hartfordhealthcare.org/services/stroke center. Really important message there. So